Hey manual therapy friends, it's Dr. David here. I'm going to bring you today's manual therapy Thursday, and we're going to do an SI joint manipulation. So there's a bunch of controversy over the SI joint and whether or not it moves, and this isn't the video for that. You have to work under the assumption that the SI joint moves to do this technique, and you have to have detected which way it moved, and there's a bunch of little things to look at. But I'm just going to show you the technique because you might find that there's a patient out there that could benefit from this. This technique is a lifesaver for some patients, in my opinion. But let me set it up for you. It's a lot like a lumbar gapping manipulation. So you have to have the patient's leg just like that on their lower leg. And then what you have to do is really wind up the rest of the spine up top. So you're taking up all the slack of the spine, lumbar, thoracic, everything up top. So I'm going to grab his right arm here, and I'm going to kind of do this hug maneuver to rotate and side bend all the way. Then what he's going to do is leave this hand on his hip here, and then this hand's going to grab the edge of the table. So just grab the edge of the table, and that's to give me some counter leverage. A lot of patients are thinking, oh my gosh, am I going to fall off the table? You have to say, otherwise it won't relax enough. You're not going to fall off the table. Just literally say that. You're just grabbing on for counter leverage because the way that I'm going to push you, I need to just twist you a bit, and I need you to hold on for some leverage. Then you're going to come around the other side, and you're going to tell the patient we're going to hold hands. Make sure you adjust your pants so nothing tears. It's happened to me before. And then you're going to have, in this case, your left foot back, right foot up. It matters. I'm going to grab hands with him, and there's different ways to grab hands. I've seen this is my favorite position, just kind of grabbing wrists more so. But you could do this one right here as well. It depends on how long your arms are and how long their arms are. I think it tends to be the most comfortable for patients. And then you got to tell the patient, give me a firm grip. You're not going to kill my hand, but I don't want you to slide off either. Then with your left hand, what you're going to do is roll the patient over a bit so that you get on their PSIS right here. So you put the middle of between your hypothenar and thenar eminence on the PSIS to use it as a ledge to push over into the manipulation. So then what you do is you test it first. I always test because you never know how hypermobile they might be at a segment, and they may not like this. But you just tell them, hey, I'm going to give you some pressure. I'm going to take you near the end range. I'm not going to thrust yet, in case, that way you have a chance to tell me that if something's bothering you, besides feeling a big stretch, I don't want you to have any pain. Stretching is okay though, okay? So I'm going to take them to the end here. You doing okay?
Yep.
Can I give you a little more pressure than that?
Yeah.
So then you wind it up and you tell them, pull me with my hand a bit. Then you give them a thrust. And that's it. And if they have a posteriorly rotated innominate, that one will shove it into the correct position or relatively anterior. So there's a lot of setup on this technique, but it's highly effective. If you want to start practicing this one, I recommend that you replay this video over and over and over again and get it just right. It just takes some time to get all the setup right, get your body mechanics right as a therapist. But once you have it down, you can make some excellent improvements for patients. So guys, tell me what you think about this technique. Let me know if it's something that you use already. I'd be happy to talk more about it if you want to learn more about it. Thanks. Have a great day. Happy Thursday.